Dr. Susan Bohrer, a small animal veterinarian in California, has been practicing traditional Chinese medicine and food therapy for 15 years. After seeing the tremendous benefits of food therapy using real, whole food meals in her patients, she decided to formulate cooked, real food, balanced meals for dogs, and she launched Chi Dog to bring food therapy meals delivered to dogs nationwide. Dr. Bohrer provides an integrative approach to dog diet and nutrition because food is the first medicine.
Hi, I'm Dr. Susan Bohrer. Thank you so much for joining me and for joining the Senior Dog Pet Summit. I'm really happy to be here to talk with you about how to use real food as medicine to support your senior dog. And really, what I want to try to talk about in this discussion is I'll bring out first kind of how Chinese medicine or how Western medicine sees seniors is different than adult dogs, how Chinese medicine sees seniors is different than adult dogs, how we see their imbalances differently, and then some look at food. What kind of whole foods can we what kind of whole foods can we use to benefit our dogs? And I'll even give you some recipes if you want to do a balanced home cooked diet. If you want to do one of the Chi Dog diets, I'll help you choose one of those to try to benefit your dog and help really promote your dog's senior years to be healthy years. So Western medicine, how does Western medicine see senior dogs as different from, just kind of your healthy adult dog? In Western medicine, we understand that seniors, as we age, we kind of get a little bit deficient, or we have some kind of chronic disease processes that can go on. And what we see is really an immune system that gets a little weaker, and we see inflammation and other chronic diseases that kind of progress as they age. So it's very, very common, skin diseases, lots of inflammatory, arthritis, painful conditions like that, various organs that start to have a little bit of issues. We can see those things happen as they age as a reflection of both their immune system that's getting a little weaker and the GI tract that's getting, that's a reflection of that. And then also the inflammation that we can see. So 70% of our immune system is in our GI tract. So I think that is a really important factor to keep in mind and help us to understand how important the food we eat is to our immune system. So if you really want to strengthen the immune system in a senior, first thing we want to focus on is, what is that animal eating? How can I strengthen that immune system through their diet, right? And then chronic inflammation and sort of the conditions that we see in seniors, specifically from a Western medicine perspective, arthritis, chronic GI issues. So that may be anything from pancreatitis, inflammatory bowel disease, gallbladder mucoceles, liver function that starts to get a little compromised as they become seniors. Even autoimmune diseases where the immune system itself starts to have some significant problems. All those are kind of the pathologies and the disease processes that we see in seniors from a Western medicine perspective. And so what I really want to bring home is how we can avoid processed food and use whole food to benefit that immune system and to really decrease the overall inflammation in the body, which is really what we're trying to impact when we are taking care of our senior dogs. So how does Chinese medicine and holistic medicine view seniors and the aging process and how they're different from, just healthy adult dogs? We see the same diseases, but we describe them differently. So we'll say in Chinese medicine, that dog, we'll say that dog has, arthritis, and in Chinese medicine, we'll say they're qi deficient. It's describing the same thing that's going on in the body, but we're looking for sort of different signs. And so some of those can be, so the arthritic dog could be a qi deficient arthritic dog or a blood deficient arthritic dog. But the big categories in holistic medicine for how we see seniors is we often see qi deficiency, which is the name we give to a kind of a disease process or the imbalance where a dog is, as they age, they become much weaker, right? So it's normally weakened a little bit, but the dog who becomes, very weak, poor muscle, tone, very difficult with appetite. We talk about seniors being picky. So that dog who really struggles to eat and to have an appetite, that's often a qi deficient dog. A blood deficiency is when we see they both have weakness in both deficiencies. But in a blood deficiency, we see more signs of dryness. So that can be a dog who has, lots of, chronic cough, can be dryness, constipation, obviously dry coat, dandruff, those can be. And so they often kind of have kind of a cold, a shivering nature to them, can be kind of seen with those seniors who are dealing with blood deficiency. A lot of seniors have both. So that can be, they can have some signs of qi deficiency and some signs of blood deficiency. We're just trying to help that senior to be stronger as they age from a holistic medicine perspective. But that's kind of a way in which the Western medicine and Chinese medicine sees them. You're basically describing the same patterns in a little different words. So So we look at the pathology of a poor diet from a Western medicine perspective. So Western medicine, we know that processed food is pro-inflammatory, right? That is well known in human medicine, that is something to be aware of. In dogs and cats, that's happening as well. So processed food is still causing inflammation in our dogs. So that processed dry and canned food is still promoting inflammation. In people, right, it's well studied that processed dog food increases the risk, or processed food, increases the risk of cancer, obesity, diabetes, lots of chronic diseases that we can see. In dogs, we're seeing the same links barely starting to be made. So there's not a lot of research, right? It's just why we're still seeing many people and many veterinarians still promoting processed kibble for every dog, even our seniors. But there is starting to be some research out. And so if anybody wants to look at the research, I love to point out one study that I thought was really insightful and very straightforward. So you can even Google it, Frontiers in Veterinary Medicine, and I would just Google whole foods or inflammatory markers, and it'll come right up. It's a study where they looked at two groups of dogs, healthy dogs, right? And they took them and fed one group whole foods, so cooked real food, and one group processed dry kibble. And they fed them that for a certain amount of time. I think it was like a couple months. And then they measured their markers for inflammation and their markers for their immune system function. So they have certain markers. I think it's tumor necrosis factor 2 and IL-leukin-2 or something. But they measured certain markers, and then they said how much inflammation and how much strength of the immune system can we understand from this dog who's eating these two different diets. And then they switched the cohorts and had those dogs eat the opposite diet and measured their markers again to see, so we could really sort of exclude other factors that are going on in that dog's life or in that dog's body. And what they found was there was a real decrease in inflammatory markers for dogs eating whole foods. So even from a short amount of time. Just a couple of months, not like years and years. So I think that's really impactful and shows us kind of what we know is to be true in humans, is that it really matters what we eat. And when we eat processed food, we increase the inflammation in our body. And that's true for our dogs as well. So looking at how does Chinese medicine understand sort of poor diet, and how does the holistic medicine understand how diet impacts and how processed food impact our dogs? So processed food in Chinese medicine, and we dry kibble, canned food. When dogs eat that food, they're putting heat and dryness into their bodies. How we describe it, and that heat and that dryness, both dries the body and they become blood deficient, and it sort of weakens the qi, weakens the energy that dog needs. They become qi deficient. And what happens is they become deficient in qi and blood. Everything kind of slows, becomes weaker and stops, right? When we get kind of stagnation in these body fluids, which is how they show the signs of all the weakness that we're seeing in these dogs. And that stagnation, though, when anything's stuck in the body, it starts to kind of accumulate heat, and it starts to get it kind of gets more congealed, right? Can get smaller. And so when it can congeal and get smaller, we can see things like tumors, both cancerous tumors and benign tumors. We see lots of signs of heat in the body. That can be anything from cognitive, so like sundowner syndrome in our senior dogs, inability to settle. Sometimes anxiety can be seen as heat, and we get true, internal dryness, which can be anything from chronic cough, diabetes, constipation, and to true spleen deficiency, where we're just seeing, poor appetite. So all these things are progressing, and all these deficiencies and imbalances are promoted by putting heat and dryness into our body through our diet. So that's how Chinese medicine views the impact of processed food on our dogs. Okay, so if we know we should not be feeding processed food to our dogs, right? We know that that's putting inflammation and heat into the body. What should we be feeding? And in traditional Chinese medicine, we do have a nuanced view of gently cooked food and raw food. So raw food can be good for some, and gently cooked can be good for some. And we say gently, we just mean like fully cooked. It's just kind of the name for cooked food, right? So when we have dogs who are young, healthy, strong, right? That dog's got great qi because they are just really strong and fully energetic, and they eat well, and they digest well, and they're full of energy and they're healthy, right? That is the dog who can be great for raw, right? That dog may do well on raw, and you'll know they do well because they thrive on that type of diet. And that dog can thrive on that diet for years. I see lots of dogs who do great on it for years, and then we just kind of watch them as they become seniors. They start to show some signs of deficiency. That may be poor appetite, that may be some diarrhea, that may, weakness or losing weight. Those things may say, this dog's chi now needs a little more support. Let's switch them over. And how do we support them? We switch them over to a cooked version of that food. Because by making that, the way we make that food more gentle is we cook it. And then it's a little easier on the chi. It requires less chi to be able to nourish the body. And then they're able to get better nutrition from their food. So the very young, I say / very strong, because a dog can be strong for years and years. Then they may do well on raw, but once they start to have a little bit of a deficiency and start to sort of age, that's when we want to switch them to cooked. So that's why we always recommend cooked foods for the seniors or cooked food for anybody who's a little weaker. So sometimes we have the dog who's 2, and just can't digest well and just has issues and, picky appetite or chronic diarrhea. That dog may be a better candidate for cooked food at a younger stage of life. It just kind of depends on their digestion. In Chinese medicine, we say it depends on their qi. And you can really see the effects of what works well for their body as you feed them, and then you see kind of how they do on that diet. So we would recommend cooked, gently cooked. We say gently just meaning fully cooked. Cooked food for our seniors or sensitive, kind of delicate dogs. Okay, so senior dogs, we know we want to feed them gently cooked food. Okay, we got that. We want to get whole foods, gently cooked, avoid processed. Okay, well, which foods, right? Now we have to think, okay, what food should I feed? Just anything? And that's in Chinese medicine where we go, okay, let's look at the action of the food, right? That's the food therapy part of it. Let's look and see what does this dog need, and what kind of foods can I use to support what this dog needs? So we're going to kind of personalize it from that. Okay, so this is the principles of food therapy. So if you guys have learned a lot about food therapy, you may already know this, but just kind of a brief overview is, and the nice thing about food is much simpler than, complex herbs or acupuncture and some other modalities. Basically, if you have a dog who has cold signs, and cold signs can be weakness, weight loss, I would add in poor appetite sometimes to that. That dog may benefit from more warming foods that are really gentle, right? So gentle meaning cooked, and warming meaning things that sort of bring a little bit of extra energy to the body. So that can be chicken, egg yolk, lamb, winter squash, oats. I always think warming foods are the foods that we tend to think of as winter foods, right? Because you usually eat foods that warm you in the winter, right? Naturally. So, and foods that naturally warm you are usually the ones that grow in the winter. So if a dog has cold signs, we want to feed them a warming food like chicken, egg yolk, lamb. The dog has hot signs can be typically inflammation, although you can see some inflammation that's kind of cold signs too. But I would say hot signs are, lots of redness, anxiety can be a big one. That can be kind of like that dog who can't settle. That can be lots of signs of, redness, kind of like, angry looking lesions. That can be inflammation, and that can be hot inflammation. So then we want to feed them cooling foods. Typically, many seniors, just like humans, we get a little hot as we get older, and we need cool as we get older. So we need help sleeping. We need help settling. We need help, calming and cooling. And so those are usually, those types of foods are usually the summer foods, right? So turkey, duck, egg white, rabbit, broccoli, barley. These are all cooling foods. And so we'll go a little more into that later on, but I just kind of want to give the basic of, if you're cold, you want to feed warming foods. If you're hot, you want to feed cooling foods. And then sometimes dogs show, real dryness signs. And in our seniors, that's usually dry. That can be dry cough. That can be diabetes, can be constipation. That dog we want to feed blood tonic. And those are usually big energy foods that kind of hydrate. And so beef is my favorite blood tonic. Can be really strengthening. Eggs can be overall a blood tonic. So you can see that some part of the egg is warming, some part of the egg is cooling. But, overall, it's a blood tonic. And then carrots and sardines are other really hydrating foods. So now I'm going to pull in some Western medicine thoughts about which foods to feed my senior dog, right? Because Chinese medicine says, well, you need a cooling food. Well, Western medicine may say, well, you need a low-fat food. Well, how do you put those two together? So Western medicine principles, we don't ignore them because they still are bringing value to this dog's diet and giving us information as to what to feed. So we think about some typical Western medicine recommendations for food, right? They're not going to say you need a cooling food. They're going to say you need a low-fat food, right? Or you need to You need a hypoallergenic food, right? So those kinds of things. So in principle, how do they apply to seniors specifically? So a senior who needs a low-fat diet, that may be a dog who's got pancreatitis, right? Gallbladder disease, liver enzymes that are elevated, all these things that we think about when it's, very common for a veterinarian to recommend a low-fat diet. So how can we do a low-fat diet without doing the processed stuff, right? You can do a low-fat diet by thinking about which whole foods are naturally low in fat. So we think about the meats, right? Because dogs should be primarily eating meat. So we think about the lean meats. So turkey, chicken, egg. Those are my top 3. If I want to have a low-fat diet, then I'm thinking those are the proteins that I want to use because they're leaner. They're naturally leaner proteins, and you can just use your own knowledge about food, right? We know turkey and chicken are rather lean meats, so that could be a good go-to for a low-fat diet. I do make a note about probably avoiding organ meats if you have a dog who really needs a low-fat diet. Only because, Chinese medicine likes organ meats for some uses in a small amount, but organ meats, avoiding organ meats may be a benefit for a dog who needs a low-fat, more gentle diet, because organs, although very nutritious, can be high in fat. So I might avoid the organs, and I might avoid, lots of organ treats for a senior dog who needs a very gentle diet. And so like our Chi Dog Fire diet is our turkey diet, our wood diet is our egg diet, our wood diet is our chicken diet, and our earth diet is an egg diet. So you can look at those whole foods. I have those as options for whole food diets that are lower in fat. So IBD, another big one that we hear about a lot, are food allergies. If we think we need a novel protein or a hypoallergenic. For dogs, if you're thinking about, if I want to avoid, the processed hypoallergenic diets, how can I get a novel protein diet for a worry about IBD in a dog? Often I'll use pork. Because pork is, here and raised, and we're in the U.S. So if you're in the U.S., it's raised here in the U.S. And so it can be used as a novel protein. Our water diet is the diet that we use as a ground pork diet that will apply for novel protein or dogs who need novel protein or hypoallergenic. So you can still get that recommendation with using a whole food. So cancer support, dogs who have cancer, we want to maybe lower carbohydrates. So we'll talk a little bit about portions here in a few minutes. But if you have a dog who you want to support who has cancer or prevented cancer, we do use a low carbohydrates. You might use only 10% carbs in that food. For our Chi Dog diets, they're all low in carbohydrate, but our earth diet and our metal diet, specifically our egg and our beef diet, are the diets we recommend to support dogs who are dealing with cancer, and they're all like 10% or less carbohydrates. So if you're cooking, you just use less carbs, more meat, more veggies, right? I do make a call out for the very seniors, and I mean like the 16-year-olds, right, who really who are very, very picky. It's very common. I tell clients it's very common to be picky when they're seniors. Know that it's just part of senior care. And then we want to go ahead and feed them a rotation diet. And it's mostly because the dog says, I'm not going to eat the same thing on Monday that I ate last Tuesday. And that's okay. That is just part of aging. So if you have a very senior dog who's, 14, 15, 16, or older, we have a few 17-year-olds, then just know that you may have to get a rotation diet, and that's okay. That's just part of how they age. Skin diseases specifically, I kind of call it any dog who's just struggled with environmental allergies and lots of skin problems their whole life. That dog, I really want them on a whole food diet. Like that is super important because it'll really benefit their skin to be off of the processed food and be on whole foods. So I always kind of make a note that if any dog who's got a skin problem, the more whole foods I can get into them, the better their skin will be. Vomiting bile or saliva, so really common. I kind of call that out too. So that dog who wakes up in the morning and they vomit a little bile and they feel a little sick and they're kind of up, but by the afternoon they can kind of get going again. That's a very common condition, and we see it. We see it in younger dogs, but more commonly as they age. So what I always recommend is make sure you're feeding frequent meals. So that might be it. That dog may need to eat 4 small meals a day rather than 2 bigger meals. And then also gently cooked. So that is a dog I don't want on raw because they're saying, hey, I'm sensitive. And then I'm sure you might have already heard, most people have, that dog who kind of vomits bile, it's empty stomach vomit. So think, can I get you some food or something in your stomach, something gentle, something cooked, right? So that might be sweet potato. That might be a little bit of, cooked meat. Might be scrambled egg, a little bit, something in their stomach before, if they're doing that kind of, they do that vomiting thing as a routine or as kind of a pattern. Watch for that and think, if I can get you small, frequent meals, so your tummy's always got a little food in it. If I can make sure that food is gently cooked, if I can make sure that food is sort of calming on the stomach. That can be a good one to help with that symptom. Okay, so now I'm going to go through some real easy whole foods that you can cook. You can we have an option if you're in the U.S. to have vitamins and minerals delivered, and you can cook 100%. You can cook so you can do a topper, right? Keep the food, but just top some whole foods on there. That's great. The more whole foods you can get in your dog's bowl, the better. You can cook the entire meal, and we'll give you some options for balance, or you can even order pre-cooked meals, and it's all lightly cooked, balanced, and complete diets as well. Okay, so basically when we're thinking about cooked food and like, okay, well, I know, say my dog has, pancreatitis or some need for low fat, and I know I want to do turkey. And so I think, okay, well, where do I go from here? Right. So basic ratios are, you want to feed mostly meat, right? Some vegetables, maybe some fruits, depending on if the dog is sensitive and if they like them, and then a little bit of grains. That's kind of the amount, the portions, I should say, that Chinese medicine recommends. And the ratios are pretty wide. So see how it says 30 to 80% meat. Well, that's a huge, spread there. It really depends on the dog. So if the dog's doing really well and you want to feed a higher meat diet, you can. And so then you could go, I'm saying, no more than 80%, because that's a lot of meat. You can do 10%, 10 to 20% organs if your dog, does well with that. If your dog is sensitive, if your dog needs a lower fat diet, you may want to do lower than that, or just omit the organs entirely. So that's an option. You can do up to 30% vegetables. I say plus or minus fruit, because I always kind of go, if the dog likes it, if he doesn't upset their stomach, because fruit is naturally kind of acidic. So just kind of know that. And then up to 30% carbohydrate. But maybe, for example, if you had a dog who you're worried about cancer, you might lower that and make it only 10%. So it kind of gives you it should be mostly meat, right? And then a little veggies and then a little grains is kind of how I think of it. Okay, so balancing, because of course, if you think about home cooking, the first thing we always think about is, oh my gosh, how is it balanced, right? So big picture is for example, we have a balanced vitamin and mineral on our website for Chi-Dog, and it's a macro mineral and the multivitamin. And so you can balance, this is all for adult dogs. So you have that caveat over a year, right? But this is, senior dogs is perfectly appropriate. And you can cook the home cooking all by yourself and then have us send you the vitamins and minerals where you can balance each portion in their bowl. This is how much for the morning, this is how much for the evenings. You're not having to do a big pot, try to figure out how much vitamins and minerals to put in that pot, because that can get very confusing. Ours is really simple, and that's why we did it that way. I think it's really easy. I used it for years with my clients when we were just home cooking before we started making the Chi-Dog meals ourselves. So it can be really easy. Other options, though, that was just here in the U.S. There are some other options. I know Just Food for Dogs has a balancing vitamin and mineral. I know Balance It has some vitamin and mineral options. Those you usually have to go through their recipes. And then My Pet Grocer has one those are just other options. Okay, so if I'm going to do kind of a food therapy meal for my senior, right? Like make it easy. How can we cook it? So this is super easy. You can do, and I do cooked. I don't worry about how many ounces to buy at the grocery store, right? Or how many cups of dry barley to use. We just think of, let's say I make these ingredients and I have the cooked version. How much should I use to make a portion, right? So you can do 2 cups. And then once you make that, you can make it's 2 to 1 to 1 ratio basically for meat, carb, and veggie. You can make that 4 to 2 to 2, 6 to 3 to 3. You can scale it up or down, but this is just kind of the basics. You can do about 2 cups. I always do ground meat. Our Chi-Dog meals are always ground meat just because we have little dogs who have little mouths. So I just kind of call that out. If you're cooking little pieces, right? Because if you have a 3-pound dog, you have to make tiny, tiny pieces to make sure this dog, we want to avoid any choking hazards or anything like that. So we use ground meat for that reason. So you can do turkey, which is cooling, chicken, which is warming, and beef, which is neutral. So 3 different options of kind of a cooling protein, a warming protein, and a neutral protein. You can do, we have oats, which are warming, brown rice, which are cooling. So very easy things that you can find at the grocery store that you can cook. And I would pick one. So I would say if I need a cooling diet, I'm going to do turkey, which is my cooling meat. I'm going to do brown rice, which is my cooling carb. And I'm going to pick a few cooling vegetables. You can always Google. There's a million websites that show you kind of what what vegetables and carbs and meats are warming or cooling. Sometimes they can be a little, sometimes you'll find like one website says this is warming and one website says this is neutral to warming. So don't get too worried. There's a little bit of a variety between site to site, but overall it's really easy to find what the actions of different foods are if you want to home cook it yourself. And then how much to feed. So that's another one I really want to call out, because if you're thinking I'm going to, cook it myself, on our Chi Dog diets, we send portion meals. So, we say 10-pound dog, we send a portion that's appropriate. In general, for that 10-pound dog, we do have some owners who will increase it a bit, which is appropriate for the needs of their dog's metabolism, or decrease it, based on their dog's metabolism, and kind of what they see when they start cooking. But in general, I do kind of want to give you some basic recipe and basic kind of portions that you might have. And I apologize. The BID is twice a day. That's a veterinary term. We always say, BID means twice a day. So if you have a 10-pound dog, you'll probably do a fourth to a half cup twice a day. 25-pound dog, about a cup twice a day. So just to kind of give you ballpark ranges about like how much should I feed a dog. A 60-pound dog should not eat a cup, right? And nor should a Chihuahua eat a cup a day. Just to kind of give you some basic, ratios. If you're home cooking 100%, you don't have to worry about the kcals, because you're not going to go have it, lab tested to figure out the kcals of your home cooking. So don't worry about that. But if you're ordering from, a company, that does the cooking, just know the kcal calculator. A lot of times people come with a calorie count that they think that they need for their dog. I always kind of call it that the calorie count is different when you're feeding whole foods, because that calorie count calculator that the veterinarians were taught in school was designed for kibble. So it will overfeed when you try to switch that kcal amount and use a whole food diet that you bought. Because like our diets on Chi Dog, we had the kcals. We know exactly how much they are. We had the lab testing. But just know that it's a little different when you're feeding whole foods, and what matters more, and what is the entirety of what matters, is just the dog's portion. And is that right for them? So we send portion meals, and we can offer guidance for anybody who wants to, who thinks their dog may need a little more, a little less. We can adjust for that. But if you're home cooking and you want to do it 100%, just know that this is kind of some ballparks to give you an idea of like how much should I put in my dog's bowl. And then you can always have the vitamins and minerals to add to your home cooking to really make a whole food diet for your senior dog that can benefit them, strengthen their immune system, right? Decrease inflammation in their body is the main goals of what we're trying to do with food therapy, especially for our seniors. That's kind of the take-home message, is really trying to bring whole foods into their diet. And the wonderful thing about feeding a senior dog this type of food, especially if you haven't before, and your dog needs to change in diet, the beautiful thing is dog is usually so much happier to actually get some real food. So that can be very fulfilling, and can feel really good to be able to give them that. So I really appreciate, you listening to this lecture. Thank you so much. I hope that you've got some ideas for how to use food and use food therapy, and to try to bring it to your dog, to your senior dog, to really help them thrive in their senior years and do well and strengthen their body as they age. Thank you so much.